audio.
Are we live, Jay?
Just 1 minute, sir. Yes, sir, we are live now.
Yes. Good evening, all the viewers. We welcome all of you on the behalf of Macroids Pharma, Osteo Division, and welcome to the 9th session of the panel discussion of Key to Unlock Immunity. I welcome Dr. Rekha Patil. She's a physician from Belgaum, and I'll hand over the session for the further proceeding. Dr. Rekha Patil. She's our chief chairperson for this program. Over to Dr. Rekha Patil.
Thank you. At the outset, good evening all viewers. At the outset, I thank the team of the Macprot for inviting us to discuss how to optimize the immunity in this COVID pandemic. So, very important key component to optimize immunity is nutrition. As we all know, nutrition is an essential part of the human health, right from an entire life till death. Since the infection in the womb, we get over an environmental insect where it is infection and non-infection. Normal, spring being a good immunity keeps us alive throughout the life. So, the right of preconception during a pregnancy and then after the birth and death is to consume and adequate nutritional components to maintain the immunity very, very strong. The many studies in the world have shown that good nutrition of mother during pregnancy is the good growth of the baby in the womb and with the infant and child. Child with a very strong immunity has got a good mental health. This is the whole way and the adult. And the adults with a strong immunity and the infection rate is very, very less. Already we have been beyond doubt. People with a strong at the less infection and if they get infected, the recovery is very good with them. And the second component of a strong immunity maintains the less inflammation in the body. And coming to a non-communicated diseases today, what we are facing, like diabetes, coronary disease, these are also linked to inflammation and strong immunity. With this brief note, I have with me my panel member, Dr. Aishwari Kalpur, who is a professor and head of the Department of Obstetrics and Gynecology, Daily Charitable Executive Hospital, Belgavi. The second panelist, Dr. Mukta, who is an budding gynecologist working as an assistant professor in Daily Charitable Hospital, Belgavi. Dr. Pooja Motimer, who is a dynamic physician working as a consultant in Upper Korea Hospital, Belgavi, and is the assistant professor in Maternal Medical College. First slide, please. First slide, please. Not Next slide, please. Here, as this picture depicts, we were the human since 1,000 years evolved. We were used to use the four limbs and we were started walking on two limbs and we have gone through the various stages and today we use the information age and we love all from our food and with this modernization at us they have become obese from improper nutrition and this obesity has involved in non-communicated diseases as well as infection rate has slide, please.
Not that clear.
Next slide, please. As we know, optimal immunity is a very, very important thing to clear the infection, where it is an viral infection, bacterial infection, parasitic infection. Many trials have proved the people with good immunity, their hospital stay is less and the recovery is fast, and post illness, the morbidity is also very less. So optimizing immunity as a very, very important factor during the health and when during the disease. So the key components to maintain the optimal immunity, we have to eat rightly. We have an availability of lot of food to us today, but eating right is something very, very different. You can say it is balanced diet. Apart from balanced diet, to optimize the immunity, we require and many times supplemental food, because today we lack the time to look into it. We have to hydrate well. We have to regularize exercise so it keeps the weight under control, and then the weight related complications will be very less. We are today the global citizens. We get connected across the globe, so our sleep cycles are disturbed a lot, and because of this disturbed sleep, our regeneration of the tissue is very, very less. So adequate sleep is again a very, very important component to boost our immunity. So we have to have an very important components to have an optimal immunity is good nutrition if required and supplement, good hydration and regular exercise program, minimal intake of an salt, sugar, adequate sleep, all together will optimize our immune status, and we can remain mentally strong as well as physically strong. Next slide, please. We have a recommendation for the daily allowances to keep the optimal health. So the question is, this daily recommendation is sufficient for an optimal immunity. Optimal health and optimal immunity are the two different things. So let us listen from Dr. Pooja. Is it the RDA is sufficient for optimal immunity, or is just sufficient to have an optimal health? Over to Pooja.
A very good evening to our viewers and the panelists. In continuation of the question, is the recommended dietary allowance of nutrients sufficient for optimal immunity? Let us first see how the RDA is met. The recommended dietary allowances are ideally met through something called as the balanced diet. According to the National Institute of Nutrition, India, our food pyramid as depicted in the picture shows that the base of the pyramid is formed by the cereals and millets, that is the wheat, rice, jawar, followed by fruits and vegetables, pulses and dairy products, fats and sugars, that is mainly the polyunsaturated fats comprising the apex of the pyramid. Based on the ICMR guidelines, RDA for Indians in calories per day include, for a sedentary man, 2,320 kilocalories per day, sedentary women, 1,900 kilocalories per day, an addition of plus 350 kilocalories per day to the basic requirements in special situations like pregnancy, and plus 600 kilocalories per day during lactation. Can we go to the next slide, please? Now, we are all fascinated to the food of the new era. They're absolutely tasty, but definitely unhealthy. And what we need to avoid include additional sugars in the form of sweet cereals, sugary drinks, carbohydrate drinks, cereal bars, cakes, pastries, French fries, pakoras, ice cream, so on and so forth, which are all so edible, but definitely not good for our health. Next slide, please. Okay. Our today's focus is particularly about proteins among the various macronutrients as well as the micronutrients. Now let us look into the daily requirements of proteins. As we can see that the daily requirement will vary as per the age, sex, body weight, and the physical requirement. In addition to the diet, special supplements should be considered, especially so in the current era of pandemic. As a brief note, we can just make a note of how much grams of protein per day is required in various people, like in the group of men, that is around 60. If we see the women, it is slightly lower, that is 55 grams per day. Requirement goes up in special situations again, like in pregnant women, it is around 78 grams per day. During lactation, especially the first 6 months of lactation, it is around 74 grams per day. And coming to the next half of the lactation period, up to 1 year, it slightly reduces to 68 grams per day. Can we go to the next slide, please? Similarly, as there is a daily requirement of proteins and it is variable according to the age, sex, and so many other factors, so also we have some of the most important minerals which most of us are aware about, like the vitamin A, vitamin B6, vitamin C. The respective generic names are given to those vitamins here. The folates, vitamin B12, certain trace elements like magnesium, zinc, the various categories of people and their requirements are given in the table. We'll not go into the details, is why I will tell you in the next slide. We'll go to the next slide. Yeah, because whatever the recommendations were there were basically the daily allowances which were recommended. But what we are seeing, especially during this pandemic, is that it may be insufficient for an optimal immunity, because they can cause a marginal subclinical deficiency range. You can see the susceptibility increases. But if deficient states come up, then they can have severe clinical deficiencies, and the problems with the deficiencies can be as miserable as death. So for optimal immune response and immune protection and resistance to infection, the daily intakes may need to be much higher than the recommended dietary allowances.
So as we understood, our daily allowances may not be adequate during when the demand is very, very high and when we are going through a pandemic. Let us know the role of proteins in enhancing an immunity. Dr. Pooja.
Okay. As we said that our today's focus is basically on the role of proteins. Now, what do these proteins do for our immunity is what we are concerned about. So basically, we all know that amino acids act as the building blocks for the proteins. They are further classified into essential and non-essential. Now, as the terminology says, what do you mean by essential? What do you mean by non-essential? Essential amino acids are the ones which we need to supplement through external formulations. That is because the body is not capable of synthesizing these amino acids, but definitely they are equally important as those of the non-essential, which need not be supplemented and are synthesized by the body's own mechanisms. These are some of the examples of non-essential and essential. The non-essential include alanine, arginine, asparagine, so on and so forth. And the essential ones include the histidine, isoleucine, leucine, lysine, etc. We'll move to the next slide. Now, why are we worried so much about the proteins? It is because proteins have got a multifaceted role and they lay the foundation of a healthy immune system in every individual. Now, there are various roles it plays, or by various mechanisms of actions, what we say, it acts. Few of them which are listed in the picture includes, it has got anti-inflammatory properties, it improves or promotes the bone growth, it helps as an antioxidative stress releasing factor, it is antimicrobial in nature, it helps as an immunoregulator, antihypertensive, helps in lowering the cholesterol levels, hence is also referred to as the hypolipidemic agent. It helps in causing anti-cancer effects, that is, it prevents the occurrence of cancers in few individuals who are predisposed. It improves the cognitive function, helps in wound healing, and definitely, as we all know, proteins help in building up the muscle strength. We'll move to the next slide. Okay. Now, after having known so many various roles of proteins, what about immunity? In particular, several studies have also reported that low protein status can increase the risk of infection. How? One is by reducing the humoral immunity, that is by lowering the antibody production. Secondly, it's been observed that a low pool of available proteins result in a decreased amount of the functionally active immunoglobulins, because proteins form the base of immunoglobulins. Protein malnutrition increases susceptibility to specific viruses like the Zika virus and influenza virus. How do they do so? By decreasing the function of the innate immunity, what is there, that is the inbuilt immunity of an individual, that is by decreasing the function of neutrophils, complement system, immunoglobulin A, and adequate antibody response. Next slide.
Now we understood from the Pooja that the proteins have multiple roles, and as well as it has a major role in optimizing the immunity, especially innate immunity, which is a very, very important thing. Now, does the dietary supplement, dietary source is adequate to optimize the immunity, or as he said, the essential amino acids are required to be supplemented into the production of an antibody, excess production of an antibody? Over to Pooja.
Okay. So we spoke about the various mechanisms by which it is helping in immunity. We will focus ourselves particularly on proteins and its role in the antibody production. The consumption of proteins with a high biological value, the most common example I can give you is an egg, is crucial for the optimal production of antibodies. From the recent studies, there is an important role of amino acids in an adequate immune response. And how do they do so? Is by regulating the activation of T lymphocytes, which is essential for the cell-mediated immunity, B lymphocytes, which are the major source of antibodies, natural killer cells, and macrophages, a part of the innate immunity. Not only this, but it also helps in reducing the cellular redox state, that is the oxidative stress on the cells. It helps in good gene expression, that is, which is going to prevent the mutations or the cancer proliferations, and also prevents or decreases the lymphocyte proliferation. It helps in regulation the production of antibodies, cytokines, and the cytotoxic substances which are responsible for the inflammatory response of the body. Most important immune effect for majority of the whey proteins, which are much talked of and will be dealt in the further slides, is the stimulation of immunity via an increase in the macrophage activity and the interleukin 8 production, which are a part of the major part of the innate immunity of an individual. Proteins hold great promise in improving the health and preventing infectious diseases.
Now we know the multiple roles of the protein in the boosting the immunity. We have an availability of an soy protein. Let us know what is the specific role of an soy protein in boosting the immunity. Let us hear from Dr. Mukta. Mukta, please.
Good evening, everybody. Yeah, so today, after elaborate discussion from Dr. Pooja, I would like to continue further. Yeah, so soy protein has a protein digestibility corrected amino acid score of 1, indicating that it is able to meet the protein needs of infants and adults when consumed as the only source of protein. The bioactive peptides from soybean have been shown to exhibit a variety of functional properties, which includes immunomodulatory, antioxidant, and hypocholesteremic effects. Yeah, so next slide. Next slide, please. A study was conducted by Dilshat et al. On effects of soybean peptide on immune function, brain function, and neurochemistry in healthy volunteers. Next slide. Yeah, the study was designed as follows. About 10 healthy volunteers were included in the study. 7 were male and 3 were female. But they were aged between 20 to 25 years. And after 12 hours of fasting, the baseline blood sample was taken, and soybean peptide was given orally, about 8 grams suspended in 200 ml of water. And after 24 hours, the blood sample was again collected. Next slide. Yeah. So the results was as follows. They noted that significant changes were seen in the soybean peptide and protein group, shown that soybean peptide had a regulation effect. Cell numbers were upregulated in the group that had fewer leukocytes, but downregulated in the group with more leukocytes. So to further classify, they divided into 2 groups. That is one, the granulocyte-rich group, which had a granulocyte count of about 60%, and a lymphocyte-rich group, which had a lymphocyte count of above 40%. Next slide. In the lymphocyte-rich group, the lymphocyte count tended to decrease, accompanied by an increase in granulocyte number. Vice versa, in the granulocyte-rich group, the granulocyte count decreased, whereas lymphocyte numbers increased. Next slide. So it was also noted the soy proteins had an effect on lymphocyte subsets, especially CD11 and CD14 cell counts, which are closely associated with macrophage activity. And it was found to be statistically significant. And also CD11 and CD56 cell numbers were remarkably increased, and which was also statistically significant. Next slide. So coming to the conclusion of the results of the study, it has been concluded that soybean peptides can modulate the cellular immune systems, both quantitatively and qualitatively. They regulated leukocytes, granulocytes, lymphocytes, and their subsets. Yeah, next slide.
So the soy protein has a major role in regulating the cellular immunity and regulating the ratio of leukocyte and lymphocyte. Let us see now what's the role of whey protein in boosting the immunity. Dr. Mukta.
Next slide. Yeah. So we all know whey protein is major component of colostrum, which is secreted in the breast milk. So we'll just talk in detail about whey protein. Whey protein, it includes beta lactoglobulin, alpha lactalbumin, lactoferron, immunoglobulin, and bovine serum albumin. The composition of beta lactoglobulin is about 55 to 65%. Alpha lactalbumin consists of about 15 to 25%. Lactoferrin about just 1 to 2%, and immunoglobulin about 10 to 15%, and bovine serum albumin of about 5 to 10%. All these proteins and peptides have been known to possess specific effects on immunity. Next slide. Yeah. So what are the specific roles of each individual components of these whey proteins? It's been described in the table. So I'll just briefly tell. In beta lactoglobulin, it has been found to have stimulatory effect on splenocytes. Also, increase of glutathione. The peptides have been found to be a carrier of retinoic acid and contraction of ileum muscle. The alpha lactalbumin has been found to have increase of interleukin-1 alpha, which is produced by macrophages. Also, it has been noted that it induces apoptosis in tumor and immature cells. And the peptides of alpha lactalbumin have modulation of B and T lymphocyte activities, and there is stimulation of adherence and phagocytosis of macrophages, stimulation of oxidative burst response, as well as now lactoferron has also been known to have inhibitory effects of cytokines which includes tumor necrosis factor alpha, interleukin 1, and interferon gamma. Also, there is upregulation of cytokine interleukin 10. There is increase in natural killer cells, CD8 cells, and CD4 cells. They also promote and differentiate T and B lymphocytes. Similarly, immunoglobulin will help in increase of glutathione. It helps in activation of complement system, increase of phagocytosis. They help in neutralize virus and toxins. Next slide. Yeah, so it has been found that whey proteins have different antiviral actions on most of the viruses, which includes CMV, enterovirus, rotavirus, H1N1, and so on and so forth. Next slide.
So now we understood that the whey protein has an antiviral property, and as well as there are important immune function it has got. Today we know we have an antibacterial, the antibiotics are very specific targeted to treat an bacterial infection. But when it comes to an viral infections, we really get lost to treat the viral infections. So the having and good supplements of these proteins, where it's a whey protein, soy protein, or the above the recommended daily allowance, when we take an adequate protein, we can really fight with this viral diseases. In sense, we can clear the virus infection very fast than the person who is with an low protein levels in the plasma. So it's very important to note over here, if we are not taking adequate through and diet, or even the prescribed dietary allowances may not be able to meet the required immune responses, we should take in the form of supplements to keep up our immunity up and to fight with these viral diseases. Because the whatever said and done, all these antiviral drugs has no specific specific outcome when we treat the many viral diseases. So keeping the immunity at optimal level is a very important factor. So the next, we move on to the next question. The breast milk has its importance since an ages. And when the breastfed infants do well, when it compared with the infants which are just fed orally, in their infection rates. So let us hear from Dr. Mukta, what is the role of colostrum as an immune enhancing agent?
Yes, we all know that there are a lot of beneficial effects. Hello. Yeah, we
Hello?
all know that breast milk has a lot of added benefits, protecting both the mother and the infant. So colostrum, it is loaded with immune growth and tissue repair factors, and it is a potent natural immune booster. The source of immune components and nutrients, it contains more of proteins, immunoglobulins, vitamins, minerals than compared to the bovine milk. It is also protective against wide spectrum of bacteria and viruses. Hence, we recommend exclusive breastfeeding for the first 6 months of the baby's life, just mother's milk and nothing else. Studies have also shown that the colostrum is the only natural source of two major growth factors, namely TGF alpha and beta, which is transforming growth factor alpha and beta, and insulin-like growth factor 1 and 2. Yeah, next slide.
So now we heard of about an protein and its role into an optimization of an immunity to fight the infection. Let us move on to, let us see what is the role of micronutrients in enhancing the immunity, because micronutrients are also equally important to maintain the integrity of an epithelial cell lining, and they have a role into an enhancing the immunity. So let us hear from Dr. Pooja, what's the role of micronutrients?
Okay. Moving on from the much talked of proteins, The next part will be the micronutrients. As from the picture, we see that immunity lies at the apex. The base is formed by the proteins, whereas the pillars are formed by the micronutrients. These include the multivitamins and the multiminerals. Next slide, please. Okay, so what is the role of these micronutrients in immunity? Complex integrated immune system needs multiple specific micronutrients like vitamin A, C, D, E, B6, B12. You just go on naming them and there's no end to it. Folate, zinc, iron, and some of the most important trace elements like copper, zinc, and selenium, which have got very important and synergistic roles at every stage of the immune response. Daily micronutrient intake necessary is necessary to support the immune function may be higher than the recommended dietary allowances which are given by the ICMR, even if there's a marginal deficiency that can impair the immunity. The available evidence indicates that supplementation with multiple micronutrients have got supporting roles which may modulate the immune function and reduce the risk of infections. Next slide, please. Okay, as we saw a similar picture with the proteins, same thing holds good for the multivitamins and multiminerals. That is for an optimal immune protection and resistance, much higher doses than the RDA are required. And the variation can be from subclinical infection in cases of subclinical deficiency range to severe clinical infection in severe clinical deficiency state, which can even be life-threatening and can cause death. Next slide. Next slide, please. Yeah. So what is it? How are these going to play a role in the immunity? So site of action in the immune system. If we talk about vitamin A, vitamin C, zinc, we know that these act as the epithelial barriers, the integrity of the skin and the mucous membranes, which can, at the first stage of infection, prevent the entry of the virus or the bacteria and thus prevent one from infection. Similarly, the same vitamins along with special vitamins like vitamin B12, E, folic acid, iron, copper, selenium have got an additional role of enhancing the cell-mediated immunity through the T lymphocytes. Then the same multivitamins and multiminerals also have got a very important role in the antibody production. So through this data, we can see from the entry of infection to if someone acquires the infection, the severity of infection and the clinical outcome can all be improved and can be changed with the adequate or much higher doses of the multivitamins, multiminerals, as will be stated in the upcoming slides. Next slide, please.
So the micronutrients has also equally role into an immune regulation and optimizing the immunity. So let us see now the impact of an individual micronutrient supplement in boosting the immunity. Dr. Pooja.
Okay. Initially, we just saw the overall picture of what it is doing. That is, it's acting as an epithelial barrier. It is improving the cell-mediated immunity. It is improving the antibody production. If we go individually, we are going to divide it into what is its impact of deficiency and what will be the impact if you supplement these multivitamins or multiminerals. We'll go one by one. Coming first to the vitamin C, deficiency state, what is its impact on the immune function? It will increase the oxidative damage. It will decrease the delayed type of hypersensitivity response and will also impair the wound healing. As a result of decreased resistance to infection, there is an increased susceptibility to infections, in particularly respiratory tract infections, that is the pneumonias. Then what is the advantage of supplementing these? High doses can help stimulate phagocytic activity, that is again a part of innate immunity, and also enhance the T lymphocytic activity. It is also known to have antioxidant properties. It protects the leukocytes and the lymphocytes from oxidative stress. It enhances the neutrophilic chemotaxis, but there is no apparent effect on the antibody production per se. In higher doses, it can help the severely ill patients in the intensive care units to recover more quickly. Similarly, moving on to the much talked of vitamin D, what does it do in its deficiency state? How does it hamper the immune system? it can alter the gut microbiota composition, reduce the number of lymphocytes, which are very important in the cell-mediated immunity. It reduces the lymphoid organ weight, that is especially the spleen. It impairs the immune capabilities of the macrophages, including its antimicrobial properties. As a result of this, there is a decreased resistance to infection. Again, it is more prone to develop respiratory tract infections. Not only that, it will cause an acquirance of the infection, it increases the severity of the infection, and it can increase the morbidity and mortality in the ones who succumb to infection. It increases the risk of other autoimmune diseases like type 1 diabetes, multiple sclerosis, SLE, rheumatoid arthritis, etc. So what is the advantage of supplementing it? Calcitriol, which is the active form of the vitamin D, which can be given even in patients with chronic kidney diseases where the role or the function of the kidneys to form the active form will be impaired, can help to restore the immune function of the macrophages. But it has not known to have any significant effects on the biomarkers of systemic inflammation like the tumor necrosis factor alpha or the interleukin 6. Moving to the next slide. The next most talked about vitamins is the vitamin E and the vitamin B6. As a part of its deficiency state, in the immune function, it can impair again the humoral and the cell-mediated aspects of immunity as well as adaptive immunity, that one which is acquired by the occurrence of infection in an individual. So there is something called as the herd immunity. Once a patient develops immunity to a particular organism and there's a memory to that infection, including B cell and T cell function, which is plays an important role in the adaptive immunity. It reduces the T cell maturation. So what will happen if you give or supplement? It is going to again improve the overall immunity, and it is also going to in the elderly, especially those who have got the infections, it increases the antibody response and will reduce the severity of infection. The same thing holds good with vitamin B6. Specifically, it is going to act at the cytokine levels where it is going to decrease the IL-2 production, which is known to be protective to the humans. It reduces the lymphoid tissue weight, causes lymphocytopenias, and the general deficiencies in cell-mediated immunity, suppression of the T helper cells, and promotion of the T helper type 2 cells, which are cytokine-mediated activity. It impairs again lymphocyte maturation, lowers the antibody responses, and even reduces the responses to mitogens. As a result of this, there is again a reduced ability to respond to the pathogenic challenge. That is, again, they become more prone to develop infections. What will happen if you supplement this? It helps to restore the cell-mediated immunity because its deficiency is causing so much problem in cell-mediated immunity. Definitely, there will be a benefit. Then it can improve the lymphocyte maturation and growth, and also increase the number of T lymphocytes. So the fighting capacity increases as the manpower. Similar to the manpower, the lymphocyte power increases in the body. And large doses can improve the immune responses in critically ill patients. Next slide, please. Now, as we are all aware of these vitamins, vitamin B12, the methylcobalamin or the cyanocobalamin, and the folate, what have got these vitamins got a role in the immune system? If there is a deficiency state, again, there is a decrease in NK cell activity, delayed type hypersensitivity. So we can just generalize it and say all types of immunity can be hampered in its deficiency. And it can potentially cause the risk of acquiring any sort of bacterial, viral, fungal, parasitic infections. So what is the advantage of supplementing? Again, it increases the number of cells with a role specifically in the cell-mediated immunity as far as the vitamin B12 is concerned. And folate can increase innate immunity in the older people and also alters age-associated decrease in the natural killer cell activity. So it is going to keep the natural killer cell activity uptight and even in the elderly individuals, and also helps the T helper cells, supports them to bring about the cell-mediated immunity. Next slide. Okay. As we are all aware that during this pandemic, everyone is talking about this trace element called zinc. Okay, everyone knows that when a patient is suffering from coronavirus, he needs to be supplemented with zinc. But why? Has it got any role? Now, trace element, as we know, the requirement will be less, but the intake is still less. That is why we need to supplement it. What is its effect if there is a deficiency? Again, on the immune function, as we see a full list of all possible immune hamperness, what was seen with all other vitamins and folate, what we saw just now, all together will be done by zinc. So it is going to impair your humoral immunity, antibody-mediated immunity, the cell-mediated immunity, the delayed type of hypersensitivity reaction, natural killer cell activity, the cytokine storm, which is known to be a major part of COVID severity, is also a part of the immune hamperness, what is caused by a deficiency state of zinc. And as a result, there is a decreased resistance to infection, increased risk of inflammatory diseases, impaired wound healing, increased all type of infections like bacteria, viral, fungal, increased diarrheal and respiratory morbidities, and susceptibility particularly increased in the older individuals and the children. So how is the supplement going to help us? Supplementation has got a beneficial effect in the intestinal immune function. That's why diarrhea can be prevented as well as adequately treated. It increases the cytotoxicity of the natural killer cells, restores thymulin activity, increases the number of cytotoxic T cells, helps in combating the different types of organisms, and reduces the number of activated helper T cells, which can contribute to autoimmunity, thus reduces the chances of autoimmunity in the body, in the sense that the self-antigen will not be destroyed by its own body. We'll go to the next slide. Similar to the selenium, zinc, we have the selenium and the magnesium. Again, has got the same impact of deficiency on the immune function and an increased susceptibility to all possible infections. What is its advantage or an impact of supplementation on the immune function? As far as selenium is concerned, it is again known to increase the cell-mediated immunity, which gives a long-term benefit, improves the T helper cell counts, enhances the immune responses, particularly to the viruses in the deficient individuals. As far as magnesium is concerned, it reduces the oxidative damage to the DNA of the peripheral blood lymphocytes in the athletes as well as in the sedentary young men. So whether you exercise or you don't exercise, magnesium is going to be beneficial. It reduces the leukocyte activation, and after exercise, if you exercise, there is going to be an extra benefit that it increases the granulocyte count and post-exercise lymphocytes.
You all now agree with me that from Dr. Pooja and Dr. Mukta, we heard that multiple functions of proteins as well as micronutrients in keeping a complex function of immunity at its optimum. And once the optimal immunity is there, the cellular and molecular functions are very good. The reserve of the tissue will be very nice. And once the tissue reserve is good, fighting with any offending agent, where it is an infection or non-infection, it becomes very, very easy to an individual. Now, let us move to the women who are let us hear from the Raishwari madam. During an ANC visit, what is the role of a nutritional assessment? As I think we have to look at the next generation, healthy born generation, who will have a positive outcome as far as their performance, and which will add to a national growth. So let us listen from madam, the role of nutritional assessment in the ANC visit.
Good evening. After an elaborate discussion and by our panelists regarding the use of proteins and how the protein is going to enhance the immunity, now I am going to discuss about how essential this protein is during the pregnancy. That is the woman's life, which is a privilege. Woman's life, especially during a privileged period of woman's life, that is during pregnancy. So we have to assess the nutritional status of the woman during pregnancy. So how we are going to assess the nutritional status? First, we have to, of course, the weight is the basic assessment, and the BMI in the first trimester, it provides an indicator for the health status of the pregnant lady. And the other screenings are biochemistry or complete blood count, whether she has got any infection, any this thing. Then dietary assessment, you have to ask her what diet she is taking, whether vegetarian, non-vegetarian, whether how sufficient the diet is there for her nutrition, and the factors which influence this diet. Even in the first trimester, even if she is taking a regular diet, but she may not be able to digest because of the hyperemesis, because of the vomiting and nausea, she may not be able to digest or absorb the things, so leading to less nutrition or malnutrition. Okay, next slide. Next slide, please. Okay, so the dietary assessment of women in childbearing year needs to include certain specific informations. Like we have to ask her the cultural food practice, what type of food she is taking. If she is a non-vegetarian, we expect that the proteins are there sufficient, so we can be casual. But if she is a vegetarian, though protein may be there, but supplementation is very important. Some people, like in Ayurveda, they say ginger, garlic, and all those things are very essential for the immunity. But some people doesn't eat those things. So the immunity, to boost the immunity, you don't depend on the diet itself. So they need the supplementation for the immunity. So the special dietary problems means, like because of the pregnancy, again vomiting, nausea, they may not be able to digest, and they may not be able to absorb the sufficient amount of diet what they take. Then of course dieting in the modern era, so most of the girls nowadays, they diet because they are very conscious about their physical this thing. So then medication, if they are on some medications like iron also, they may not be able to tolerate some food. So that also we have to take care of. Or they are allergic to some drugs, we have to take account of this. Economics, of course, is a very important factor. Next slide. Okay, so to assess the maternal nutritional status, so the maternal nutritional assessment is very, very, very important. How we are going to assess the maternal nutritional assessment? It is a minimal, like it is assessed in 3 levels: minimal level assessment, mid-level assessment, and in-depth assessment. So in 3 level, we are supposed to assess the nutritional status of the mother. So in the minimal one is a dietary, whether she is taking a regular diet, balanced diet with a regular time, and what type of diet she is taking. That is very important. Next is a medical battery. Next is medical and socio-economic is the obstetrical history you have to take. If she is a multi, then depends on if she is age, means teenage pregnancy, they may not be nutritionally very efficient to carry on the pregnancy and delivery and for the lactation. And at the same time, parity, if she is having 3 or 4 deliveries and interval between each pregnancy is very less, so definitely nutritionally she may not be so competent to carry the pregnancy and for the better immunity. Then what you have to do is medical, if she has got a intercurrent diseases, intercurrent illnesses, or whether she is smoking, taking alcohol, all these history is very important. And of course, as you know, Indian family and the social this thing is very important. Whether this pregnancy is a wanted pregnancy, unwanted pregnancy, depending on that, how much care they are going to take and worry about their nutritional status. And because of that, if the nutritional status is not adequate, so the immunity is not adequate. If the immunity, as you know, that pregnancy is a high risk for COVID-19, so immunity is not there, then we have to be worried about that. Then clinical examination, like if they know the pre-pregnancy weight gain during pregnancy can give away some idea that nutritionally she is better or she is nutritionally deficient. If they don't know the pre-pregnant pregnancy weight, at least in the first booking, first trimester, if you know that, then you can give the supplements and see for that. Of course, the hemoglobin is very important to know the level of the blood, that means anemia. So you have to look for all these things. This is the minimal level maternal assessment. This is the routine for all the antenatal patients. Next is at the mid level, what you are supposed to do is we have to same history we have to take, but little elaborate, like how what type of food she takes, how much intake is there, and all these things. And about that, whether in other part, medical and socioeconomic, whether she has had a spacing, she had any contraceptive use, all those things you have to take history. And if she has any recurrent infection or a recurrent, intercurrent diseases, so you have to, if she has, then you have to take care of that. Then above that, you have to look for, if she is anemic, you have to look for the serum iron levels and RBCs, indices and all you have to go through. In depth means again the same thing, but in details we have to, whether they have got a skin fold, any other, along with that folate and vitamin deficiency are there. So you have to take care of the folate, vitamin levels, measurement has to be done for them. Next slide, please. Next slide.
What are the special nutritional supplements that you would like to recommend during first, second, and third trimester of pregnancy?
Okay, madam. So not only the immunity or not only the nutrition, we are talking here of optimal nutrition and optimal immunity. So the optimal nutrition in pregnancy, that too in the COVID era, and since you know that pregnancy is a high risk group, so nutritional counseling is a must during the antenatal care. That is the first objective and the first thing we have to think of and do it. And the next is the diet and supplements. So diet, as you've already discussed so much about proteins, micronutrients, and diet and the supplements. So these are all for the good immune system and successful for pregnancy outcome. So diet, regular balanced diet, and whatever the supplements advised should be taken by the patient, so that the immune system is developed well and she will have a optimal immunity, optimal nutrition, and successful pregnancy outcome. So hence what you are supposed to advise her is eat right, that is a balanced diet, and hydrate well, and proper exercise activity, and whatever recommended drugs and the supplements are there, they are supposed to consume them. Okay, next slide, please. Okay, so during preconception and the first trimester, ideally we know that folic acid should be given preconception, but the best part of folic acid is you should start from the teenage or the adolescent age only. We can start the folic acid, that is 400 microgram per daily. So you are supposed to give at least preconception. If not, patient has attended you, at least the first trimester, first booking, you must start with the folic acid 400 microgram per day, at least to reduce the neural tube defects. Okay, what are the, other proteins, or what we are supposed to advise them is proteins, folic acid, vitamin B12, and zinc. These are the other supplements which we are very important nutrients. Okay. Second and the third trimester, as you know that the second and third trimester, 90% of the fetal growth takes place. So what we have to take care of them, because we don't, when the second and the third trimester, especially third trimester, the chances of small for gestational age baby or the growth retarded baby. So we are going to diagnose them. So we don't want to diagnose them. If you don't want to diagnose such things, then you have to give the patient the proper protein diet, and you should advise them to take the proteins, which are very, very, very essential for the immunity and for the pregnancy outcome. So the nutrients during this is again protein, iron and calcium, magnesium, omega-3 fatty acids, and DHAs. Next slide.
As we heard from the madam, is and again very, very important right from the preconception time, from the adolescent age, and then during all the trimester of the pregnancy, consumption of protein and other supplements with a background of the pregnancy induced nausea or vomiting, the ensuring the adequate supplementation the lady takes for then successful outcome of the pregnancy. After the delivery, the breastfeeding is a very, very important thing to have a very, very healthy child with a less infection rate. As we heard from Dr. Mukta, the colostrum has a very important role, and even the breastfeeding. Now let us hear from Madam. During the lactation time, the mother's needs are there as well as the baby's needs are there. What are the protein supplements during lactation should be done? Your views on this, Madam?
Okay. So as per the ICMR RDA, proteins and minerals, how much we are supposed to provide them. Then men, see, our Dr. Pooja has already discussed about the men and the women. I'll only enlighten about the pregnant woman and the lactation period. So what is important is, according to the body weight in the pregnant woman, if she is a 55 kg patient, so what is the net energy kilocalories required per day is, that is, I don't think that the pregnant ladies are not heavy workers, so they are moderate workers. So I expect them to have a 2,230 grams kilocalories per day. Along with that, plus 350. So it will be total 2,580 kilocalories per day. Then during the lactation, that to the first 0 to 6 months, that time only exclusive breastfeeding will be there, along with the kilocalories moderate worker woman. Along with that, plus 600 kilocalories to be added for the same. Next is 6 to 12 months, you can add 5 or 20 kilocalories. Okay, so accordingly, this is a kilocalories. Accordingly, the proteins, fats, calcium and iron. So as we have already discussed, during pregnancy, all these essential proteins and micronutrients and traces are to be taken in a excessive or in a supplement way. So the proteins which are in plus, pregnant ladies plus 23 grams of protein per day. Then during lactation, plus 19 grams protein per day. Excess she is supposed to consume. Of course, in calcium also same thing, like 1,200 milligram per day calcium and 1,200 milligram calcium even during lactation. And iron is 35 milligram per day and 21 milligram per day. So in overall, proteins, micronutrients like calcium, iron, and everything should be in a increased amount. So, okay, next slide. Next slide.
Now we know that during a pregnancy, the requirement goes quite up and we require to supplement. So do you recommend the supplementation in all pregnant patients or for some subset of patients?
Okay. Next slide, please. Okay. Daily requirement of proteins already we have discussed, like in pregnant woman, 2,580 kilocalories and the proteins is 78 grams per day. Same during lactation, 2,830 kilocalories, 74 grams of protein per day. And during lactation in that 6 to 12 months is 2,000, comparatively very less, 2,750 kilocalories, that is 68 grams of proteins per day, as per the actually age and the body weight. Okay, in addition to diet, these supplements should be considered. Okay, especially today's current pandemic situation, we have to take care of this because of the immunity. Okay, next slide. Actually, this is a meta-analysis. What they have showed is protein requirement increases from first trimester to second trimester and further in lactation. So providing pregnant and balanced protein energy supplements lead to this reduction in the gestational. As I had already told, this protein supplements is leads reduction in the risk of small for gestational age infants or small for intrauterine growth retardation. It reduces intrauterine growth retardation, and especially during the undernourished pregnant woman or repeated pregnancies or economically very poor this thing. So the supplementation of protein is a must for them. According to this, that is the statistics. Next slide. So must to use protein supplements are, one is malnourished patients, repeated pregnancies, and where their BMI is very low, and for those who have got a IUGR, that is intrauterine growth retardation, and the baby is small for the gestational age, and sarcopenic patients. All these patients, the protein supplementation is very, very important for us to improve the nutritional status, which further improves her immunity. So we want to make a optimal immunity. So want her to have a optimal immunity. So protein supplementation is a must for her. Next slide, please.
Now we have many patients who are obese one, who are having the family history of diabetes. They may be having some impaired glucose tolerance. So you want to have an evaluation for these patients, and what type of protein supplements which don't contain the sugar you would prefer in your practice.
Next slide. So as during the antenatal period, definitely we look for the pre-diabetic patients, that is impaired fasting glucose. So this is a routine screening for all the pregnant ladies. And during the history, we know that the family history of diabetes or the previous history of diabetes, previous pregnancy history of diabetes or she was a diabetic earlier, now or any patient with a pre-diabetes, and patient is very obese, and when of course all these patients we have to give them proteins but no sugar. So no sugar should be added, that is a sugar-free protein should be supplemented to them. Of course, some patients who are very calorie conscious, we should not give them the sugar. I mean, they should be also be given no sugar proteins. Okay.
So
Okay,
thank you, madam. In all, what we learned from Dr. Pooja, Dr. Kadkol madam, and Dr. Mukta, that the mother's nutrition writes the horoscope of an baby's health right in the womb. And after the birth, we write our health horoscope by consumption of and food. So it's very important, if we want to be healthy and strong enough, we should consume an adequate amount of food which will be balanced one to keep up the health, and as well as to keep up our immunity at very, very high level. As the saying goes, what we are, what we eat, you see. So that is what I would like to say. There are certain recommendations. Next slide, please. Next slide, please. So it has been showed in many studies, when the patient get admitted into an hospital, assessment of the nutrition is very, very important. If we are checking for a nutritional assessment, clinical as well as biochemical, the people who are having the malnutrition, the mortality is high, the hospital stay is long, and after the recovery, the morbidity is high. So it's very, very important to assess the nutritional status for any patients who is getting admitted. And right now, during the pandemic of COVID, again, it is very important. During this COVID era also, it has been shown that the elderly people, the people with multiple comorbidities, who are malnourished, in them the mortality rate is very, very high. So when the patient get admitted, so once you assess and nutritional status, optimization of the nutrition is very, very important. Either you assess or you make a nutritionist as a part of your team, and then optimize the nutrition by giving, next slide, please. Next slide. By supplementation of proteins, vitamins, minerals, and all this through biochemical parameters. Many times all the biochemical parameters cannot be done like for a trace elements and all, but it is very, very vital to supplement even the trace elements to them to have a good outcome when we are treating the patient in hospital. Next slide, please. Next slide. So before we go to a regular physical activity, what I would like to say, when the patient is admitted in hospital, assessment of nutrition, supplementation. Supplementation, what are the types of supplements we can give? We can do an oral supplements, we can give an eternal supplements, we can think of the parental supplements depending on the type of patient we are dealing, where the patient is an general ward area or intensive care unit, where he is able to eat, where he is intubated, or where what is his other components are there. Taking into all these things consideration, supplementation, either oral, enteral, or parental, is very, very important to achieve an optimal nutrition. Once we achieve the optimal nutrition, the good effects of optimal nutrition is wound healing, the recovery rate will be good, hospital stay will be reduced, and the patient can get discharged, and the post illness, the morbidity is very, very less. So from the supplement, we can plan to recover at least 400 kilocalories and more than a 30 milligram of protein. Sometimes whole of the protein can be supplemented through formulas, because patient may not be able to take, or there are issues of loose motion, there are issues of non-absorption, there are issues of distaste, so many problems will be in their hospital. So it may vary from the case to case, but nutrition should be an cornerstone of treatment, or it is one of the important component in the treatment protocol when we are treating the patient in hospital. If we are treating the patient at home, again it is important to assess nutrition and keeping the nutrition optimal for a good health and optimize the immunity, so the longevity is ensured, and that will be a quality life for the people around us. Next slide, please. I think thank you. So the nutrition is a very essential component of everyone's living, where during health or during the pandemics or during any thing, we should take care of our own health by taking adequately all the supplements, if required supplements, especially protein, multivitamins, multiminerals, because as we heard from all the panelists, what is important. I thank our viewers for patiently listening to all of us, and I thank the team of the Macleod for giving us the time and opportunity to discuss our views over here. Thank you all. I would like to take if any questions are there.
Narendra, do we have any questions?
No
chat?
question.
Ma'am, thank you so much for enlightening us. I'm Dr. Amit Kamra, and I take care of the medical department from Macleod's. And it was indeed an evening well spent, and we were honored to have you all. My special thanks to our chairperson, Dr. Rekha, and Dr. Rajeshwari, Dr. Mukta, and Dr. Pooja. And we wish you a nice evening ahead. And it was indeed an evening well spent.
So stay fit, stay healthy. Thank you all. Good night.
Right, ma'am. And I hope, ma'am, that the knowledge that we have disseminated on nutrition will go a long way in educating the healthcare community.
Thank you.
Thank you, doctor. Thank you.